Joining us live now is Professor Crabb, Director and CEO at the Burnet Institute. Appreciate your time. Why is the death toll rising, considering TB is preventable and curable?
So it's a great question, but it relates to COVID, of course, and we see it with any major disruption, whether it be an economic downturn or a war, as we're seeing in Ukraine at the moment, but most particularly another infectious disease like COVID. It just throws health systems out, and especially in developing countries where those health systems are fairly fragile and poor in any case, they just can't cope. And so what we've seen with TB in the region is that diagnosis of TB has dropped a lot by 84%, and that's meant that a lot of people are not getting diagnosed and a lot of people are not getting treated. When you're not getting treated, you die of TB. And so the death toll for the first time in a decade is going up, and presumably there's a lot more transmission than there was before. So this world's biggest ever infectious disease killer is, of course, number 2 in the world at the moment to COVID, and will be number 1 again once COVID is brought under control. So we just can't let this get out of control any more than it already has. We've probably put ourselves back a decade with what's happened with COVID.
Professor, I think a lot of viewers would be surprised to know that we haven't managed to completely eliminate TB in a country like Australia. Why is it proving so hard to do so, particularly in the Northern Territory?
TB gets a foothold wherever there's inequity. It's a complicated pathogen. It's difficult to deal with, this bacteria that we don't have very good drugs for, we don't have very good vaccines for. You need a very decent health service. You actually also need people to be healthy. They need to be fed, they need to be in good housing, you can't crowd people together and so on. So wherever that occurs, even if that occurs in Australia, such as in some of our populations, Indigenous populations in our north or migrant populations throughout Australia, you'll still have TB. But the big TB problem is not, of course, in Australia, it's to our north and to our northwest, in particular in Southeast Asia and in South Asia, where most of the world's TB is. And there you have simply an incredible problem. Up to 2 billion people in the world have TB, and around 10% of those will get active TB in their lifetime. These are just astronomical numbers. So it's a huge health problem, and it's an economic problem counted in the trillions, not even in the billions. So it's one of the worst things of diseases of our existence, human existence, and to most people's surprise, it still is.
So what responsibilities do you think Australia has to help in our region, considering that the Asia-Pacific region is so hard hit? What are we already doing? What would you like to see us doing going forward? Well,
Australia's been tremendous in the past at contributing to various mechanisms that deal with TB. And the number one of those mechanisms is so-called Global Fund for HIV, TB and Malaria, this partnership between many governments, philanthropic agencies and experts in the space, civil societies and so on. They came together 20 years ago. They effectively are a funding pool, so you get the purchasing power of lots of funds coming together, and Australia's been a generous contributor to that. The next funding round is coming up, and we as global health experts in Australia are just saying this is a very special moment in time. It's up. We need to up the ante, effectively double our commitment to the Global Fund. Other governments need to do similarly, because if we let this 10 to 15 year gap, where we're on schedule for 2030, 90% reduction of death from TB in 2030. If that pushes out by another 15 years, that's not only 6 million more people dead, it's $3 trillion to the world's economy. Clearly, we're talking about investing billions to save trillions. It's a pretty good investment. I can't think of a better investment. And what we're really asking the Australian government to do is to throw the kitchen sink at TB, like we've done so successfully at COVID.
Well, speaking of COVID, while we have you, Professor Crabb, I am keen for your thoughts and your assessment really on the current COVID situation in Australia right now. How do you expect that may change in the coming months as we head towards winter? And what would your message be to those who are arguing that Omicron is mild, the pandemic is over, it's time to move on?
Well, clearly the pandemic's not over. We're seeing as many deaths in the world as we've ever seen at the moment, but we've entered a very different phase. We don't need to live in lockdown. We don't need to live with border closures. We can start to go about our lives again. Here I am in the office, for example. But I'd like us to do that in the clear recognition with the mindset that the pandemic's not over, and also that vaccines, even though they're the cornerstone of our response, there's no question about that, they are absolutely tremendous, they're not enough. And if we can change our mindset away from this vaccine set and forget, from we don't need to worry about COVID anymore, both of those things are not true, then I think we can have a series of public health interventions. I still favour good quality masks in the right settings, not everywhere, but in the right settings, treating the air quality in our office spaces and in our schools really seriously. If you don't have clean air, you should get in trouble for that. You should be forced to have clean air in those environments. And still testing and not so much tracing, but isolation at the moment is still very important. If we take those things seriously, we can live in an environment where there's lots of COVID. We've got many deaths, 30-odd deaths a day in Australia, and it's going up. These are very big numbers. We have a big long COVID problem that is ahead for us, like it is for many countries. So I think there's a way to be open and to treat this seriously at the same time. We haven't quite got that balance right at the moment.
Professor Brendan Crabb, appreciate you joining us with your insights. Thank you so much.
Anytime. You're very welcome.